வணக்கம், குட் மார்னிங். என் பெயர் டாக்டர் பிரபாகர். இன்னைக்கு மே 2021 Physiology பேப்பர் 2 MCQ 11 to 20 MCQ வந்து டிஸ்கஸ் பண்ண போகிறோம். ஈச் பேப்பரில் வந்து 20 MCQs இருக்கு. ஸோ கொஞ்சம் MCQ வந்து நம்ம ட்ரெயின் பண்ணால் ஈஸியாக நம்மளுக்கு வந்து ரெண்டு பேப்பர்லையும் சேர்த்து 40 மார்க் வாங்கிடலாம். ஸோ MCQ கொஞ்சம் அட்டன் பண்ணுறது கொஞ்சம் டிஃப்ரெண்ட். ஏன்னா 4 ஆப்ஷனும் சில நேரத்தில் ஒரே மாதிரி இருக்கும். ஸோ நம்ம கொஞ்சம் எக்ஸ்ட்ரா கேர் எடுத்து பழைய யூனிவர்சிட்டி பேப்பரில் உள்ள MCQஸை போட்டு பார்த்தாலே நம்ம ஈஸியாக மேக்ஸிமம் மார்க்கை நம்ம வாங்கிடலாம். The 11th MCQ, Brown-Sequard syndrome is characterized by all the following except. So Brown-Sequard syndrome is the hemisection of the spinal cord. With the help of diagram, we can discuss this MCQ. So in the MCQ, 3 options are correct. We go to take the incorrect answer. So this diagram depicts the hemisection of the spinal cord, this level below the medulla. The first option, loss of vibrations on the opposite side below the level of lesion. In the Brown-Sequard syndrome, the below the level of lesion, same side is, this is blue color is the dorsal column pathway. Dorsal column pathway is same side is affected. The dorsal column pathway carries the vibration, proprioception, fine touch, stereognosis, 2-point discrimination, tactile localization. These sensations carried by the dorsal column pathway. So loss of vibration sense on the same side below the level of lesion is occur. Opposite side, pain temperature sensation is lost. Below the level of lesion, pain temperature sensation is lost. So option A is the incorrect answer. Okay. So this is the incorrect answer, but we have to discuss the other options. Option B, loss of voluntary movement on the same side below the level of lesion. The below the level of lesion, what happened? The UMN paralysis will occur. UMN, upper motor neuron paralysis will occur. So the patient cannot do the voluntary movement. So this is the correct. Option C, loss of reflex movement on the same side at the level of lesion. At the level of lesion, all the sensation lost and element type of paralysis will occur. So we cannot elicit the reflex. So this is also correct point. Okay, this is the feature of the Brown-Sequard syndrome. Option D, loss of pain sensation on the opposite side below the level of lesion. So the below the level of lesion, the pain sensation, spinothalamic tract is affected. So loss of pain sensation on the opposite side below the level of lesion. So in the MCQ, incorrect answer is the loss of vibration sense on the opposite side below the level of lesion is the correct answer for this MCQ. 12th MCQ, the lateral motor system of spinal cord is formed by following tracts. So 4 options given, we can explain with the diagram. So this is the spinal cord. So motor tracts, what are the motor tracts present in the spinal cord? This is the tectospinal tract, this is present medially, and corticospinal tract also present little medially, rubrospinal tract also present medially, reticulospinal tract also present medially. Laterally, the olivospinal and vestibulospinal tract both are present laterally. So option A, vestibulospinal and olivospinal are the correct answer. Other things are medially. Reticulospinal is rubrospinal medially present, corticospinal rubrospinal is medially located, and reticulospinal also located medially. So correct answer is option A. Vestibulospinal and olivospinal is the correct answer. 13th MCQ. The afferent climbing fibers to the cerebellum originate from. So they gave the four options: superior olivary nucleus, inferior olivary nucleus, superior vestibular nucleus, inferior vestibular nucleus. So you should know the neuronal circuit of the cerebellum. So climbing fibers originate from the inferior olivary nucleus of the medulla that directly stimulate the Purkinje cells. It is used collateral to the tip cellular nucleus. So inferior olivary nucleus is the correct answer for this MCQ. Inferior olivary nucleus is the correct answer. Okay. Another one fiber is the Mosi fiber. Mosi fiber is originate from the other than inferior olivary nucleus, from the higher center, brainstem, spinal cord. These areas gives the Mosi fiber. Climbing fibers originate from the inferior olivary nucleus. Which of the following part of the eye has the greatest concentration of the rods? This is the 14th MCQ. Four options given. Option A, iris. Option B, optic disc. Option C, fovea. Option D, parafoveal region. So option C, fovea, in this region no rods are present. Rods are absent. No rods seen in the foveal region. The largest number of the rods are seen in the parafoveal region. 1,60,000 rods per millimeter square seen in the parafoveal region. This is the correct answer. So option D, parafoveal region has the greatest concentration of the rods. 1,60,000 rods per millimeter square. 15th MCQ. Taste buds are absent in. Option A, the fungiform papilla. The fungiform papilla, each papillae contains 10 taste buds, average 10 taste buds. So this is not the correct answer. Option P, filiform papilla. In this papillae, taste buds are absent. So this is the correct answer. We can discuss the other options. Option C, foliate papillae. It contains numerous taste buds in the papilla. The circumvallate papilla, option D, circumvallate papillae. It contains each papillae 200 taste buds. So answer is taste buds are absent in the filiform papillae. 16th MCQ. Sympathetic stimulation of the bronchus causes. Option A, bronchial constriction. Bronchial constriction produced by the parasympathetic stimulation. So this is not the correct answer. Option B, increased secretion from glands. This is also occurs in the parasympathetic stimulation. So this is also not correct answer. Option C, no effects. So this is also not correct answer. Option D, bronchial dilatation. Sympathetic stimulation produces the bronchial dilatation and decrease secretions from the bronchial glands through the B2 receptor. So this is the correct answer. So sympathetic stimulation of the bronchus causes bronchial dilatation. 17th MCQ. Which of the following changes would tend to cause accumulation of fluids, edema in tissue? So most important mechanism behind the edema formation is the increase the filtration into the interstitial tissue space. So that edema formation mainly occurs due to the increase the hydrostatic pressure of the capillary. Second, decrease oncotic pressure in the plasma. Third one is the increase the capillary permeability. Fourth least cause the lymphatic obstruction. Okay, here we see the options. First option is the increased precapillary vascular resistance. Increase precapillary vascular resistance decreases the capillary permeability. Decreases the capillary permeability in the vessel. So it will not produce, it is not the correct answer. Option B, decreased post capillary vascular resistance, that will decreases the hydrostatic pressure in the capillary. That will decreases the hydrostatic pressure. So it will not produces the edema. So decreases the hydrostatic pressure will not produce the edema. Third option, increased plasma colloid osmotic pressure. So it is not this will not also produce the edema. So decreased plasma colloid pressure only produces the edema. Option D, increased venous pressure. So increased venous pressure, it increases the capillary permeability. It will occur in the congestive cardiac failure condition. So this is the cause for the edema formation. Option D is the correct answer. 18th MCQ, the most powerful stimulus to initiate CNS ischemic responses. Okay. So what is CNS ischemic response? It is the fastly acting powerful mechanism, physiological mechanism. Whenever the blood flow to the brain is decreases to the lethal stage, okay, when the blood pressure is less than 50 millimeter mercury, that CNS ischemic response will act. Okay. So that conditions, the local carbon dioxide concentration in the medulla is increased greatly, that stimulate the sympathetic vasoconstrictor system. The pressure area in the vasomotor center is activated, that try to increases the blood pressure. So answer is the option A, carbon dioxide accumulation in the medulla is the correct answer for the CNS ischemic response. 19th MCQ, true about pain pathway is option A, these are myelinated AB afferent neurons. Actually, pain sensation carried by the A delta myelinated nerve fibers and C unmyelinated nerve fibers. Slow pain is carried by the unmyelinated C fibers and A delta myelinated fibers. So this is the wrong answer. Option B, glutamic acid and substance P are the neurotransmitters released at the synapse. This is correct answer. And option C, nociceptors are rapidly adapting receptor. This is wrong. Nociceptors are non-adapting receptors. Okay, so this is a wrong answer. And pain sensation is carried by the anterior spinothalamic tract. Anterior spinothalamic tract carries crude touch sensation. So pain sensation carried by the lateral spinothalamic tract. So option B is the correct answer. 20th MCQ, muscle spindle is option A, receptor for a variety of multisynaptic reflex. Okay. So this is the wrong answer. The receptor for the multisynaptic reflex is the nociceptors. Painful stimulus is the receptor for the multisynaptic reflex. Option B, receptor for the stretch reflex. This is the correct answer. Muscle spindle is the receptor for the stretch reflex. Option C, occurs only in anti-gravity muscles. Stretch reflex not occur only in the anti-gravity muscle. This is the wrong answer. Option D, excited by both stretch and contraction of the muscle in which it is located. The stretch reflex is excited by the muscle spindle stretch reflex is excited by the stretch, but the response of the stretch reflex is the contraction. So this is not the correct answer. Okay, receptor is the stretching, stimulus is the stretching, response is the contraction. So stretch and contraction is not the stimulus. Okay, stretch is the stimulus, contraction is the response. So option B is the correct answer. Receptor for the stretch reflex is the muscle spindle. I hope this MCQ discussion will be helpful for you. If you like this MCQ discussion, share your friends. Thank you for watching this video.